Good morning, everyone, and thank you for being here. I'm Congresswoman Nydia Velázquez, representing the 7th Congressional District that encompasses Queens and Brooklyn. Today, we are on the brink of an unprecedented healthcare crisis in America. In July, Donald Trump and Republicans enacted the largest healthcare cut in our history when they passed their big, ugly bill and gutted nearly $1 trillion from Medicaid. Because of that, 50 million Americans, including more than 1 million New Yorkers, will lose coverage. But that is only one part of the healthcare crisis Republicans are creating. They are also intent on letting vital ACA tax credits expire, which will force more than 20 million Americans to pay an average of 75% more for coverage. In my district alone, more than 8,000 families will see their health care costs go up if these credits are allowed to lapse. Donald Trump promised the American people he would lower prices on day one. Instead, under his administration, the cost of living has only gone up, and his actions are making health care unaffordable for millions. And now, Republicans have triggered a shutdown that will hit New Yorkers hard. Tens of thousands of federal workers across the state are being furloughed or forced to work without pay, including 5,731 in my district. Families face delays in benefits like Social Security and Veterans Assistance. Programs like SNAP, WIC, and Head Start are at risk. Hospitals are left waiting for reimbursement, and housing support for families and seniors are in jeopardy. This week, Democrats were in Washington, ready and willing to do the people's business and avoid this outcome. Republicans choose to leave town. We cannot and we will not accept a budget that strips health care from working families. Democrats are united to reopen the government, extend these critical tax credits, and protect affordable health care for every American. I want to thank our Democratic leaders for being steadfast in protecting health care for working families in New York and across the nation. And I will send this message to the Speaker Johnson. For once, be the Speaker of the House and be the Speaker of the American people. What you are doing is unconscionable. You are relinquishing our responsibility of Article 1 to do our job as co-equal branches of government. So, whether you are responsible for the crisis that we are facing today and in the future, and the fact that you do not want to swear in a newly elected member of Congress from Arizona, Adelita Grijalva. Why is that, Mr. Speaker? Is that has anything to do with the Epstein files? I hope no. And now I would like to introduce our Democratic leader, Hakeem Jeffries.
Good morning, everyone. It's an honor and a privilege to be here. I'm certainly so thankful for the friendship and the leadership and the partnership of Congresswoman Nydia Velázquez, who has brought us together here today. Of course, it's an honor and a privilege to stand with the mighty New York City Congressional Delegation, Congressman Greg Meeks, Congresswoman Yvette Clarke, Congresswoman Grace Meng, tremendous leaders in the Congress, of course, led by Congresswoman Nydia Velázquez, and joined by both Ken Rasky, representing the great hospitals of New York City, as well as SEIU 1199, are great healthcare heroes. This is an all-hands-on-deck effort in defense of the healthcare of the people of New York City and everyday Americans all across the country. House Democrats have made clear, we will sit down with anyone at any time, at any place, in order to try to find a bipartisan path forward to reopen the government, to enact a spending agreement that meets the needs of the American people, and to address the Republican healthcare crisis. Here's what we will not do. We will not support a partisan Republican spending bill that continues to gut the healthcare of the American people. What Republicans have unleashed in terms of this healthcare crisis that they have created is unprecedented, unconscionable, and un-American. The largest cut to Medicaid in American history. Hospitals, nursing homes, and community-based health centers closing all across the country and at risk of continuing to shut down because of what Republicans have already done in their one big, ugly bill. The Republicans refuse to extend the Affordable Care Act tax credits. And as a result of that, tens of millions of people, including many right here in New York City, are about to experience dramatically increased premiums, copays, and deductibles that will put them on the verge of medical bankruptcy and deprive them of the ability to get the coverage that they need for themselves, their children, and their families. This is an unprecedented Republican healthcare crisis, and it must be addressed with the fierce urgency of now. That's why House Democrats and Senate Democrats are standing up for the healthcare of everyday New Yorkers, of working class folks, of the middle class, and of hard-working American taxpayers. And we're not going to bend, we're not going to break. We're going to do what's necessary to deliver a spending agreement that actually meets the needs of the American people as opposed to hurting the American people. And Mike Johnson and House Republicans need to get back into town. Do your jobs. Democrats will be present. Democrats are ready to get the job done, to reopen the government, to pass an enlightened spending agreement, and to address the Republican healthcare crisis. We're on duty. It's a shame that House Republicans remain on vacation. Am I good? Okay. Okay. All right. Okay. All right. It is now my honor to yield to the distinguished gentleman, the King of Queens, and a tremendous leader for this country and throughout the world, the Honorable Greg Meeks.
First, let me thank Leader Jeffries for the hard work, for the focus, the dedication. And guess what he does? He puts Americans first. And the House Democratic Caucus, with our colleague Nydia Velasquez and Grace Ming and Yvette Clarke, and all of the New Yorkers. I want New Yorkers to know that your New York Democrats are here and ready and working for your health care benefits. And we are not going to bend and yield to someone who does not want you to have health care. Look, first, if the record should reflect, and we should not forget, that this president was the president that went after Senator McCain when he was trying, and they tried, I don't know how many number of times, to shut down the Affordable Care Act. So the evidence is clear that this president does not care about health care for the average, everyday American. Takes care of those super rich, but when it comes to health care, and health care should not be a privilege for a few, it should be the right for everyone. So just remember, When McCain went thumbs down on the Trump plan, he went ballistic and continued to talk about how this should not take place. And then when I hear this morning a number of Republicans talking about, well, we should negotiate, we got till December. No, we don't. We know that letters are going out to Americans starting November 1st. And they have to make a choice. If we're waiting till December, those Americans will lose their health care because they won't be able to afford it. And then I heard some Republicans say, oh, we can negotiate afterwards. No, we need to negotiate now as a result of that, but also as a result of their not being trustworthy. Because we've seen this president time and time again, when we do have a bipartisan agreement, reneging on those deals and taking things back. So we can't trust him in that regard. We must have something done, and we must have it done now on behalf of the American people. Now, why did we have to wait to the last minute to be discussing health care? You know, the House Democrats believed in March that the bill, because it was Donald Trump's spending bill, not the bipartisan bill that we passed in December, this was the Donald Trump bill. And this is the same Donald Trump bill that we're talking about now. And so it will hurt. Now, between March and today, how many times did the president say, Leader Jeffries, Leader Schumer, I want you to come to the White House now so that we can have a conversation about health care and moving forward? How many times did he say, I want to make sure that we resolve this issue before the next deadline? I can tell you how many. 0. Not once. The initiation, and again, is from Hakeem Jeffries, who said we need to meet. And Hakeem said, and initially, even before we get a few weeks back, Mr. President, let's sit down. The president said no. He said consistently, we don't need to negotiate with Democrats. We don't need to talk to Democrats. And he pushed it because, you know, the president is also the de facto speaker of the House. It's not Johnson. The de facto speaker of the House is Donald Trump, because he tells Speaker Johnson, so-called speaker, what to do, when to do it, and how to do it. He doesn't move without it. So the de facto speaker is Donald Trump. He doesn't let anyone make any deals without him. And so when Leader Jeffries said, let's meet, he said no. And only finally on the last minute did he come back, when he saw that he had to do something, did he invite and agree to have the meeting that was requested by Leader Jeffries and Leader Schumer. So if he didn't do it between March and currently, what makes you think he's going to do it before Americans start losing their health care? They decided he wanted to shut the government down, as opposed to making sure that every American has the right to health care coverage by extending the Affordable Care Act tax credits and rescinding the Medicare cuts, as you've heard, which are the largest in the history of the United States of America. So there's no credibility there. He'd rather shut the government down than to make sure that Americans have health care. We can, if he's going to negotiate later, and if he wants to agree, as some Republican senators are starting to say, because you know what? This is not just a Democratic fight. We're not just, you hear what he's doing, he's targeting Democratic states, etc. What we're doing helps Republican states. It helps Republican constituents. We're taking care of Americans. We believe in America and all of its people. Democrats, Republicans, and independents, they all will benefit from this, while this president tries to target just Democrats by taking away certain issues. So this is clearly unprecedented and a Republican shutdown of our government holding the American people hostage in a way that he has been doing since he stepped in. He's been reducing in the government from day one, firing people, threatening to fire folks now. We hear what he's trying to do in New York State, rescinding. It is the Republicans. It is a Republican shutdown that will devastate folks. So this, go it alone. Now, I've been here for a long time. Anytime we've had anything, it's got to be a bipartisan, Democrats and Republicans negotiate and work it together. And that's what should have been happening now, but this president prevents that from happening. And so, what we know, as Nydia talked about, the number of people in the state of New York that would lose their health care, and I can talk about specifically in my district, because district by district things are happening in that regards. So in my district alone, if we have this, I can tell you that there's 13,000 Americans in my district whose insurance would go up by 44% if we don't get this done. And and it is middle class families that will be hurt. So let us tell the President of the United States, stop shutting down the government, come and do things as we do in regular business, regular order, and let's work this out. Because we know if we don't, what also is going to happen, nursing homes and hospitals will be forced to either reduce services or shut down. And so with that, I want to bring an individual who knows more about that than anyone as far as hospitals are concerned. He is the president of the Greater New York Hospital Association, and hospitals in New York are in danger. Nursing homes are in danger, which means every New Yorker, every American would be affected. But Ken Rasky can speak on it and tell you about the dangers of the Republican shutdown and the reduction of health care benefits to Americans. President Ken Rasky.
Thank you very much. To Mr. Leader, the distinguished members of the Congressional Delegation, my good friends and allies, this is a very challenging time in the healthcare community for all of us. We really take a look at two impacts here. And I want to be clear, there are two impacts. The first impact that we're going to find out is occurring simultaneously with this conversation. And that is the bill that was passed, H.R. 1, became the bill, also known as the Big Ugly Bill. And that particular bill is going to take $8 billion out of the New York hospital system, okay? That will affect everybody. That affects Medicaid patients, that affects all the patients that use our institutions. Today, 2 out of 3 hospitals in New York lose money, and that's before the $8 billion is taken out. What will that translate to? Unfortunately, we take a look at what this could trickle down to. We know, and this is with a heavy, heavy heart, that our beloved workforce will take a brunt of the cuts. We're going to have to lay off tens of thousands of individuals. We've estimated as many as 34,000. God forbid. These are the hard-working individuals, the nurses, the aides, all those that contribute to the healthcare community. And these are the people that will be at stake. This is what happened in this past summer. That's part 1. And that's unfolding now. Now we get into part 2. Part 2 is where this debate comes in, because the leadership wants to restore those cuts, and thank you. Thank you for doing that. But in addition, there's more cuts. Could you believe it? More cuts to come down the road. And part of that is the elimination of the tax credit and subsidies for health insurance. And this could affect 1.5 million New Yorkers. And sure, as Congressman Meeks said, a 44% increase in premiums. So what's going to happen? Is it going to be food on the table? Is it going to be clothes on the back? Or is it going to be health care? Something's got to give. Something's got to give. And these are very, very bad choices. In addition to that, $1.5 billion will be taken out of safety net hospitals. These are the ones that are hanging on by their fingernails currently. You know who they are. They're all over New York. They're in your neighborhood probably. And they are at risk. Finally, ladies and gentlemen, this is a personal note. I'm in the healthcare business, but I'm also a consumer of healthcare. I've been in our healthcare system. I know how important it is. And let me finish with this. Your health and your family's health should not be the subject of politics. Thank you.
And now let me introduce my esteemed colleague, Yvette Clark.
Greetings, everyone. As Nydia has said, I'm Congresswoman Yvette Clark. I represent the 9th District of New York, which is located in central and southwest Brooklyn, and I'm the chair of the Congressional Black Caucus for the 119th session of Congress. I want to take this opportunity to thank my dear friend, mentor, and colleague, Congresswoman Nydia Velasquez, Leader Jeffries, and the colleagues of the New York City delegation for being present and hosting this press conference today, as well as everyone, including the press, who has been here as we shed light on the Republican government shutdown and how Democrats refuse to stand by while this radical regime wages its crusade against the American people. As you can plainly see, the New York delegation will continue to fight for our constituents, and that will never change. No matter how turbulent or troubling these times may be, we will fight. We will win. Well, folks, here we are in the 4th day of Trump's shutdown, and sadly, it's already that the president and congressional Republicans have no interest in ending it anytime soon. Rather than devote any effort towards reopening the government, they are singularly focused on abusing this shutdown to advance their own twisted political goals. Truly, I've never seen a collection of so-called public servants hold such a genuine and callous disregard for their own communities. They're daring us, their own constituents, to hold them accountable. After shutting down the government last week, House Republicans decided to take an extra week to vacation instead of going back to Washington to work and reach a bipartisan deal to fund the government, and that the American people will have access to quality health care services. We, on the other hand, the House Democrats, understand the urgency of reaching a deal to reopen the federal government. We understand the urgency of stopping health care costs from soaring out of reach for millions of Americans who are at the same time suffering under the cruel Trump-imposed tariffs and DOGE cuts. Right now, we are facing the most aggressive attack on health care in modern history, with the largest cuts to Medicaid and Medicare ever. Make no mistake, Trump and House Republicans are threatening the lives of millions of Americans with this government shutdown and the passing of the big ugly law, stripping away access to affordable health care, essential medical research, mass firings, weakening our national security, and cutting pay for crucial public servants. Point blank, period. Donald Trump and Republicans have spent months making life harder and more expensive for Americans. In New York alone, over 118,000 constituents will lose health care coverage, and over 1 million will face higher insurance premiums, deductibles, and copays. And right now, as we speak, Americans are getting notices that their health care premiums are about to skyrocket by a whopping 114% because Congress has not extended health care tax credits. Now they're using the government shutdown as a ruse to line the pockets of their billionaire friends, all while throwing the blame on immigrants and Democrats. Here are the facts. Undocumented immigrants are not eligible for health care tax credits nor comprehensive Medicaid coverage. Full stop. Democrats have not proposed changing that. We have simply set out a proposal restoring access to certain health care programs for legal immigrants who will lose access under the big, ugly law. But they continue to spread their lies and propaganda and spew misinformation to their base to deceive them and hide their true agenda. Throughout the 119th session of Congress, MAGA Republicans have passed legislation on purely partisan lines and have celebrated their cruelty. Republicans control the House, the Senate, and White House. This is their government shutdown. And we will not be bullied into complicity with this deceitful scheme to rob the American people of their human right to access to health care. These folks refuse to collaborate, negotiate, or work with Democrats for an outcome that satisfies the necessity that is accessible and affordable health insurance and come to the negotiating table. They would rather make racist memes and troll our Democratic leadership like children than do right by the American people. Their sheer lack of compassion for humanity is galling, unserious, and unconcerned about the devastating consequences of their leadership and policies on the people in our nation should disturb us all. Leader Jeffries and Senate Minority Leader Schumer made clear to Donald Trump in the Oval Office, health care is our red line. And in response, Trump is on a cruelty and vengeance tour. He and Russell Vought have his partner in cruelty and robbing the American people, are also threatening to take away resources for funding to blue states if we don't acquiesce to their demands to vote for the demise of our own people. As part of the federal government shutdown, Trump and his budget director, Russell Vought, are targeting New York because our fearless leaders in both the House and Senate said no to Trump. So they have ordered the freezing of approximately $18 billion for two major New York City infrastructure projects on October 1st, including the Hudson River Tunnel project and the 2nd Avenue subway project. As we have all witnessed by now, when this administration doesn't get its way, they resort to vengeful, and harmful attacks to bully the nation into submission. These men have decided to weaponize their positions to force compliance with their unconscionable demands. Democrats will not give in to a tyrant. We're here to fight for health care, our democracy, and the dignity our communities deserve. And to our Republican colleagues, enough is enough. Work with us on a bipartisan solution that protects people, not one that causes maximum distress, harm, and pain to our communities. Let me thank you for being here today and now yield to my dear colleague and friend, Congresswoman Grace Meng.
Thank you so much, Congresswoman Clark. Hi, everyone. I'm Congresswoman Grace Meng from Queens, and I want to thank our friend and colleague, Congresswoman Nydia Velázquez, and her team, and all my colleagues, especially Leader Jeffries, for all coming together this morning to address this current Republican shutdown. And thank you to everyone behind us who is standing with America in support. This Republican shutdown that New York and the nation are being forced to endure, all because Republicans are refusing to address the current healthcare crisis, is unacceptable. People will die because of this Republican assault on our healthcare. I'll say that again. People will die. Let's not mince words. Let's not sugarcoat it. People will die. Congressional Republicans are playing Russian roulette with our American lives. This is not a game. It is not a joke. It's as serious as it could be. We are talking about life and death here. I have heard from constituents who've told me that slashing their Medicaid benefits will devastate them and their families. They have said that they will not be able to afford doctor's appointments, prescriptions, wellness exams, and more. This past week, we stood with cancer survivors who came to Washington, D.C. One of them told us that the Affordable Care Act saved her life, with tax credits helping her afford the treatment that she required. She said the day after her first chemotherapy session several years ago, the Republican House voted to dismantle the ACA in one of their many failed attempts to do so. Luckily, this did not happen, but she now stands to be hit extremely hard if her health care is impacted by the shutdown. We should be able to fund the government without gutting the needed care that families rely on. Putting tax credits or these lifelines on the chopping block will cause New Yorkers and millions of Americans to lose their health care, and millions more to face soaring price hikes. In fact, recent nonpartisan polling shows that the majority of Trump supporters actually support saving these tax credits. They know that it doesn't just include low-income individuals, but middle-class New Yorkers, people who are self-employed, those who own or work for small businesses, and people without coverage or no insurance through their jobs. 9,000 of the people that I represent in my district alone rely on these tax credits to help keep their monthly premium payments low. For households in my district in Queens, the cost of health care could increase by thousands of dollars annually. And in our state of New York alone, more than 1 million people will face higher premiums. How could we vote for something like that? These crucial tax credits are lifelines, and Democrats are at the table in Washington last week waiting for the Republicans, ready to negotiate a bill that both funds the government and lowers costs. It's time for Republicans to come to the table and do the same. We cannot let our families in New York and across the nation forego necessary treatment because they can't pay the medical and hospital bills that they will be slapped with. The attacks we've been seeing on healthcare have got to stop. These tax credits, these lifelines need to be extended, and the cuts to Medicaid must be reversed. Republicans promised to bring costs down on day one. Now they need to keep that promise and do so by working with us to keep care affordable and protect coverage for millions of hardworking families across this country. Let's end this Republican shutdown, and let's end it now, because New Yorkers and Americans deserve better.
Thank you.
Thank you, Grace. And now I'm very grateful to Tyronica Buckmeyer, a New Yorker, who will speak about how her family is impacted by the potential loss of ACA tax credit, and Cassandra McGuire Anoji, a caregiver and proud member of 1199. Veronica.
Yes, thank you. As an immigrant, I've learned to live with things I can't control. But as a human being, there are things that no one should ever have to question. Healthcare is one of them. Right now, leaders in Washington are allowing enhanced premium tax credits to expire, the very support that keeps Affordable Care Act plans within reach for millions of Americans. Here in New York, that means over 220,000 people are at risk, and as many as 80,000 New Yorkers could lose their coverage and become vulnerable. Let me tell you what that risk looks like in my own family. My youngest sister is 16. She has severe sleep apnea, a condition that gets worse with every year. She needs overnight hospital tests, possible surgeries, a CPAP machine, all currently covered by Medicaid. In a few years, without the essential plan, she won't be able to afford it. My younger sister is 19. She's lived her whole life with severe asthma and allergies, EpiPens, inhalers, nebulizers. She was intubated twice before the age of 5. Now she's in college,
ready to work and build her life. But once she ages out of Medicaid, her medication will cost more than her rent. She will be at risk of having to choose between breathing and keeping her lights on without the essential plan. And me, I'm 31. I live with chronic venous insufficiency, a condition that causes pain and swelling in my legs. For years, I didn't know why I had those symptoms, and I couldn't afford to find out. As an undocumented immigrant, I wasn't eligible for coverage. But the essential plan changed that when my status changed. Now I can see doctors, I can manage my condition, I can prevent blood clots, and most importantly, I can stand here today, healthy, and speak to you. That's what healthcare does. It doesn't just save money, it saves lives. The essential plan isn't charity, it is stability. It is the bridge that lets families like mine survive, work, and dream. Because affordable healthcare means financial security. It means dignity, and it means hope. I've seen friends in other states ration medicine, skip doctor's visits, and dig through old prescriptions just to feel okay. That is not a choice, that is desperation. New Yorkers deserve better. We cannot afford another wound in our community. So I'm asking, protect us. Don't let our care be stripped away. Don't let our cost of living between the cost of life itself. Don't let our hospitals become overwhelmed by the uninsured sick. Everything else is already so expensive. Don't add our healthcare back to the shelf of unattainable goods. Let's keep healthcare affordable for New Yorkers. Thank you.
Good morning. My name is Cassandra McGuire Nochi. I'm from Brooklyn, New York. I've worked in healthcare for over 20 years. I'm currently a recreation leader at a Starlight City nursing home in Brooklyn. I'm out here on a Sunday morning to speak to you of our residents in the nursing home, my community, and all New Yorkers who deserve quality health care. This is the 5th day of Republican forced shutdown of the federal government. All just because they refuse to protect affordable health care. Some of these Republicans claim that they aren't cutting insurance from people who, quote unquote, deserves it. As a healthcare worker, I know everyone deserves healthcare. As a caregiver, I worry about many of my Brooklyn neighbors losing their affordable healthcare insurance. Republicans voted to raise affordable health insurance premiums, and now they will spike by 75%. Working New Yorkers cannot afford to pay more for their health insurance. People can barely make ends meet right now. Why are Republicans making everything cost more for regular American families? If Republicans have their way and make insurance unaffordable for 22 million Americans, that will happen throughout Brooklyn. What will my neighbors do when they are ill or need life-saving prescription medication? When feeling sick, you shouldn't be afraid to go to the hospital or you cannot pay the bill. If the Republicans have their way, more Americans will die, hospitals will close, and services will shut down. They will create longer wait lines and higher costs for everyone. Affordable health care saves lives. Thank you to Congresswoman Vasquez and everyone here today for fighting to lower health insurance costs.
Thank you, Tyronica and Cassandra, for sharing your stories. And we are here to say to you that we will continue to fight to make sure that healthcare remains affordable for every American family. And now we will take any questions that you may have.
Leader Jeffries, for anyone,
Yeah.
evidence or feeling that you're winning in the court of public opinion, as you said on your podcast?
Well, I think survey after survey has made clear that the American people understand that Donald Trump and Republicans shut the government down because they do not want to provide health care to working class Americans, middle class Americans, and everyday Americans. We also have made clear that we'll sit down with Republicans anytime, any place, at the White House, in Congress, to have a bipartisan conversation about reopening the government, but it has to be a spending agreement that improves the quality of life of the American people and doesn't hurt it in an environment where the cost of living is already too high, where Donald Trump and Republicans promised to lower costs on day one. Costs aren't going down, they're going up. And now because of this Republican health care crisis and their refusal to extend the Affordable Care Act tax credits, we're going to see premiums, co-pays, and deductibles skyrocket for hardworking American taxpayers. That's unacceptable.
Any other questions?
Sorry.
Any other question? Well, let me just say, and this is a message to the American people about this shutdown. This is not a Democratic issue. This is an American issue. And the Republicans, both leaders in the Senate and in the House, they must come to terms with the reality that they don't have 60 votes on the Senate. So it cannot be our way or the highway. We are open and willing, and our Democratic leader constantly has stated that he is willing to sit down and negotiate, but not at the expense of affordable care for the American people. Thank you very much.
Thank you. Well done.